Welcome to your first module in the health promotion class. In this unit, we'll talk a little bit about what health promotion actually is. We'll define that and give some basic foundations that we can build on over the rest of this semester. So just to give you a little bit of a context, as a BPK student, you have spent a lot of your degree learning about structure and function. You've been learning about anatomy, physiology, how the body works, how it's structured, and how structure relates to function, and then also how structure and function relate to movement as well as part of the kinesiology part of this degree. And then something major that we've learned in this in your degree as well is like why movement is so good for health, all the reasons why physical activity is good for health. So we kind of understand the body as BPK people. But the question remains is, if we know all these things are good for our health, if we know movement is good for our health, if we know that not smoking is good for your health, if we know that eating a particular diet is good for your health, so what? Like, knowing that is only part of the battle. How do we actually help people? How do we make those changes in the population? So if we know physical activity is good for health, how do we get more people to be physically active, right? If we know that people having strong family units, having strong communities, if that is good for health, which we do know, which the research says as well, how do we promote that as well? The question isn't in health promotion, like what does it mean to be healthy? It's, we've already kind of done the work of like what promotes health. Like we know what promotes health. So how do we get people to do that? And not just like us forcing our opinion of what's healthy onto other people, but also helping to empower people to increase control over their own health. So that is the definition of health promotion. And this comes from the WHO. Health promotion is the process of enabling people. So we're helping people. We're not telling people what to do, although we might inform on best practices. But ideally, we're not strong-arming people and saying like, you do this or you're a bad person. Ideally, we're helping people take control over their own health so they can improve their own health, right? And then what do we mean by health? According to, the first WHO kind of get together, was that health is the complete state of physical, mental, and social well-being, and not just the absence of disease. So historically, health really only mattered when you weren't healthy, like when you had disease and we had to like deal with that disease. But according to the WHO, and definitely according to health promotion as well, health isn't just about not being sick. It's also about like physical, mental, and social well-being. It's about living well. It's ensuring that all of these aspects of health are kind of at the best place they can be for you for now, although that can change with life over the course of our lives. And while if we're doing health promotion properly, it should, an outcome of doing health promotion properly, whatever that means exactly, should be that people are living healthier lives. And if people are living healthier lives, disease risk should go down. That's not really the goal of health promotion. Like, it's kind of like a fun side effect of health promotion that disease rates might go down, right? But health promotion is also about like now. It's not just about the future. It's like, how do we get people to increase control over their health now? How do we get them to live healthier lives now so they can enjoy those benefits today and in the future? So while disease prevention, like I said, is a potential amazing side effect of health promotion, it's not just the only goal. We're not telling people to be active just so they reduce the risk of cardiovascular disease, right? Although that's a fun side effect. We're also getting people to be active because it, improves their concentration that day. It improves their ability to do all the things they need to do on a daily basis. It improves their mood. It improves blood flow that day. There's all these like immediate results of healthy behaviors that aren't just future-based. So just to distinguish between health promotion isn't exactly the same thing as disease prevention, although it's hard to like completely separate them either. And while health promotion isn't exactly disease prevention, it does help to prevent disease, and we can use a bit of this disease model to understand what we mean by upstream versus downstream health promotion. So downstream health promotion, these are efforts to help people when they're already maybe not as healthy, where people have already have potentially certain diseases, they already have ill health, things maybe aren't great as far as their social, mental, and physical well-being. So you could argue they've already kind of gone over this waterfall, this cliff that leads them to the ill health, but we can still promote health in these individuals, even though they've kind of already developed the thing that ideally we don't want them to develop. Okay, so I think of like cardiac rehabilitation programs where someone already has cardiovascular disease, maybe they've already had a heart attack, and can we have a program in place that helps direct people towards these cardiac rehabilitation programs and their supportive programs as well, so we can promote their health right now, even though they already have the disease, right? And ideally to reduce the risk of mortality, but also to reduce the risk of that disease getting worse. Though efforts in health promotion can also be very upstream as well. So can we ensure that people don't develop heart disease, don't have a heart attack to begin with? Can we put things in place to, have certain policies around anti-smoking, for instance? And those could be public education programs, or those could also be like policy programs around where you can and can't smoke and having restrictions around smoking. So yes, people don't develop heart disease, but they're also healthy right now. And then more upstream health promotion, this would be, this would be like, how do we get people to just never even start engaging in that negative behavior to begin with? Or how do we get them to start engaging in a healthy behavior to begin with so they don't even start on a pathway of ill health? So the point with upstream versus downstream health promotion is that we can target people, we can target groups of different stages of their health journey, and we can promote health at different stages of a particular person's health journey, not just to prevent mortality and morbidity, but also to improve health today, right? To improve social, mental, and physical well-being today. Something else worth clarifying here is a little bit of a difference between public health and health promotion. So I've already given you a definition of health promotion. Health promotion can be found within public health efforts. Public health efforts involve both health promotion and disease prevention and treatment to improve health outcomes of a large population. So usually when we say public health, we're talking about like government initiatives. We're talking about the government of BC. We're talking about the government of Canada. We're talking about more like national, state, international level things, public health. Population health is a little bit more narrowly focused. So population health can again employ health promotion practices or disease prevention practices or disease treatment practices, but these are focused more on a narrower population. So for instance, population health measures might just target like women in the lower mainland. Okay, that would be a population health target that is maybe based on public health goals and uses health promotion strategies. But this class will mainly focus, I'll try to use the word health promotion more than anything else, and this is a bit of a more broader term that of course can feed into public health and population health as well. One other thing I want to say before we move on is that it's actually kind of hard to promote health. It's not easy, and you know this because we've been trying to promote health for a long time, and there's a bunch of people out there that don't necessarily have the best health outcomes or the current health as well. And so it's hard to do. I want you to keep this in mind. We're going to talk about complexity theory this semester and talk about why it's so difficult to promote health. But something else, a couple other things I wanted to bring up is that it's hard to promote health in a vacuum. Health promotion needs often political investment, political capital, political interest, political advocacy. We need to sometimes call these top-down approaches. We need people who are at higher levels of decision making to be invested in health promotion because they often can make the changes that have the biggest level of influence. So that speaks to, again, public health like we just talked about too. So political influence, sometimes people have said about this class gets a bit political. It's impossible to separate this out. Right? Because one of the most important strategies for promoting health is healthy public policy. And you can't promote health if you don't have systemic structures that help you promote health. Okay, so political influence is critical. And something else really important to remember about health promotion and public health in general and public health as well, is that it takes a long time. Especially when we're talking about politics too, it often takes a long time to see change. And that's why we need coordinated efforts from groups that want a change in different aspects of their health. There's a reason why Indigenous people have been fighting for self-determination and for sometimes basic human rights, which is ridiculous, for clean drinking water. It's been a long time they've been fighting for things, and we're just starting to see some more changes these days, and there's still a long way to go as well. So changes don't happen overnight. They often have to be fought for, and that's what makes health promotion quite difficult, but I would say it also makes it kind of exciting as well. It also, but can make it feel a bit frustrating when we have to do so many coordinated efforts and advocate so much in order to see changes that sometimes feel like common sense changes. Another example of how much you need political investment and also how slow changes are just the state of healthcare in the United States. There isn't universal healthcare in the United States. There are some people that really absolutely want that, and there's some people that absolutely don't. Maybe looking at it from a Canadian lens, we might think, well, or not even just from Canada, but from a lot of other places in the world where universal healthcare is there in theory. We might look at the United States and say, well, why don't you have universal health care? Well, there's a lot of things going on there, a lot of political struggles going on, and there's people that have been advocating for, universal health care for a long time, and although it's changed a lot in the past 15 years, it's still not equitably delivered, and we would still not say that there is universal health care in the United States. So again, this speaks a little bit more to healthcare as opposed to health promotion, but health promotion helps make changes in healthcare as well. So I don't want to make it seem like health promotion is all like fun and like, it is fun, but it's not all like perfect and sunshine and rainbows all the time. It's difficult work, and that's why it's important to believe in what you're doing. And although we're going to focus a lot at the population level in this class, we're also going to focus at the individual level and the interpersonal level too. So while you might not be able to change, Canadian public policy around a particular health promotion initiative, you probably have influence on the people in your immediate vicinity, the people around you, and maybe you do in the future have some sort of health-related practice. You can promote health in those settings as well. If we want to see larger changes, though, we do need to really invest in, advocacy at the public level, and we have to fight for it for a long time to see changes. So just to remember that. So that's a little bit of an introduction into health promotion, and I will see you in the next unit.